Well, having 38 years in the field of experience, I've seen all sorts of students we've had. The students who do well are very detail-oriented. They're very driven to succeed. They're willing to learn a lot of new things because particularly in the healthcare field, there's always new things. So we're looking for somebody who has, an affinity to detail because that's really where it's at. We deal with a lot of data and information that's very exacting, so we want somebody detail-oriented. We want somebody who's very professional, who's driven to success. So we're looking, and a good communicator, because even though we're not talking directly to patients, there's still a lot of interaction with other departments that depend on the information we do. So we want, a very well-rounded person. And again, that's what we're seeing when we see students from Lakeland. It's predominantly, we need somebody who's kind of medically oriented, particularly if you have some already knowledge of the medical field, it is helpful. But we also have successful students who don't have any medical background at all, because during the courses they take, they do learn a lot of the information they need to be successful in the career. A lot of care is given to what do they need to be successful. Certainly there's certain elements that the American Health Information Management Society or Association recommends and requires, but I think the electives and things like that are very important for the success of the student. And I think Lakeland does a good job in selecting the electives they need to be successful in the real world. So I think their practicum experience gives them a little more exposure to different settings and people, because when the day is done, it's that practical experience that really helps them acclimate into the working environment. You can read all the books you want, but that experience, I think, is just essential for a successful student. And Lakeland has a lot of good affiliations with a lot of hospitals in Northeast Ohio. The nice thing about Lakeland is we have an opportunity to have them do their practicums at university hospitals. So we see them before we even hire them in a lot of cases. And even the ones that don't do their practicum at the university hospitals, we've had a very good experience with the students out of Lakeland. So when we see they've graduates from Lakeland, we already know what kind of quality, what kind of curriculum they've gone through. So we're very, we have a very good relationship with the school. Well, in Northeast Ohio, healthcare is a large employer. I mean, we have two large healthcare systems in the state of Ohio. I work for one of them. It is tremendous as far as the field. This electronic health record has opened up the possibilities more than any time in my 38-year career. We have opportunities, whether it be in coding or release information or information governance. If you're very good with computers, there's many things that you can do now that you couldn't do when the record was paper-based. So, anyone who's kind of acclimated to the computer is now, many more jobs are available in health information services than there ever was before. I never even heard of health information 38 years ago when I went to school. I wanted to be a pharmacist. And I changed my career over when I learned about health information services, because you don't really work with the patients per se. I mean, you're helping them, but you're not working with them. For instance, some coders are putting, the codes for the bills that go out, and they interact with insurance companies. You once in a while do have a patient that calls up and asks about a particular code you might have assigned or something like that. So it's kind of an indirect relationship with patients, but you're not working directly with them. But you are helping them, which is kind of nice, because everybody in healthcare, the ultimate goal is to help our patients and customers.